Welcome to Cued In, everybody. We are excited about the opportunity you guys get today with Harrisonburg Rockingham Works and exploring and participating in Cued In's mission. Cued In wants to help you students and young professionals to research careers, to discover their potential, enable educators to reach the future generation of learners, and then empower employers to engage and recruit the next generation of talent. So today you are participating in that mission. And so we are excited about this partnership with Harrisonburg City Schools and Rockingham County Public Schools in forming this first ever virtual Harrisonburg Rockingham Works. Today, we're excited about the lineup that we have with regards to health science, and I'd like to pass it along to Miss Eva Robertson, who is going to be facilitating the session. Eva?
Hi, I am Eva Robertson. I'm a behavior support assistant at Wilbur Pence Middle School. I'm also a ballet teacher of college students and high school students in Harrisonburg. And I'm really delighted to introduce Michael Wilburn. Michael Wilburn is a physical therapist at Drayer Institute in Harrisonburg. He has 17 years experience. He also manages a few other Drayer clinics throughout the Shenandoah Valley. And for those of you considering the profession of physical therapy, he has this to say: it is a great profession for people who like to be around other people and get to know them. And also if you like to help people and if you're a good problem solver. So I will hand it over to Michael.
Hey, everybody. Happy to be on here. I'm always happy to teach others about what we do. Physical therapy is a great profession, a very needed profession. And in times when you're probably looking at what do I want to do in the future, and there's a lot of jobs out there that have different levels of security going into the future. But physical therapy is one of those that people are going to need for a long time. And if you're like I was when I was your age, I had heard of physical therapy. I thought it was something that sounded neat, but knew very little about it. And so we're going to start off with a little video here that helps you to see a little bit about what we do, but also know that there's lots of different settings when it comes to physical therapy.
I teach, I learn, I treat, I invent, and I care.
You have to be able to communicate.
Motivate.
Every experience is different.
There's no cookie cutter approach.
And it's rewarding.
I strengthen.
Enable.
I treat.
We heal.
You're helping those who can't do.
Caring.
Educating.
Encouraging.
Just helping people.
Funulating.
You need to go in with a completely open mind because something very cool might come out.
I'm a physical therapist here at the National Rehab Hospital in Washington, D.C. This is the cardiac rehab, so we're working with patients with heart conditions. You get to use your thinking skills, analytical skills, problem solving. I mean, her BP 135/95. And you get to do so much. It's really awesome.
Thresholds. Right now we're in Independence Square. It gives the patients an opportunity to practice the things that they've been working on in a real world setting. So this is a kitchen that we're in right now, and it's set up just like any other kitchen. The sink works, it's got knives, it's got plates, it's got food, and you get to practice. The best thing about being a physical therapist is getting to see your patients improve. When you get to see them go home on that last day and they're walking out when they came in a wheelchair or they came on a stretcher, and you get to see them leave. Walking.
We're going to walk down, touch the wall, come back to the exact same spot. I'm a board certified neurospecialist in physical therapy. I see everything from spinal cord to people who are dizzy, stroke. I mean, people come back from Iraq. I mean, you name it, we see it. We're looking to see what we can do to maximize his overall function. It's never boring. It's always different, and you can actually try to pull in your clinical reasoning skills skills, the best evidence that's out there, what the patient values, put it all together and see whether or not you can really make a difference.
I see mainly geriatric patients in outpatient therapy, so I treat a lot of the cancer, rehab, and the lymphedema population. I think the best thing about being a physical therapist is that you are a motivator and a coach. It's not meant to be deep because the lymphatic system is directly underneath the skin.
I am a student physical therapist. Here, within a neuro setting, certainly you put your hands on, so you teach the patients what to do. But there comes a time where, it is just mental. So you put your hands on the patient, it's now time for them to do as much as they can.
I'm Tim Dockin, physical therapist with Fairfax County Public Schools. Take it off. Will has cerebral palsy. Good. Got it. Want to sit down? Yeah. Yeah. More than just being a physical therapist, I think, we're an advocate. And so we see so many aspects of these kids' lives and that we can help them out.
You're touching the side. Try not to touch the blue.
Our whole goal here in the middle school is to prepare them for high school. We make most everything into a game.
All right, there you go. Oh, nice one.
So the more fun we can make something, the more willing they are to do it.
Okay. Got it. Good job.
Andy had meningitis when he was a kid and had some brain damage because of that.
3, push up. Good. Stand up there. No, don't you sit down. Don't you sit down.
When I had decided to change careers and go back to school, I went and worked in an outpatient clinic, and I saw how they were getting people better.
Pull me down. Reach with your hand.
The people I worked with were great, and the difference you made in these people's lives were great. This is Andrew, and he's 12 years old. He has cerebral palsy, so he has trouble controlling his movements.
And both together. Okay, Andrew, stop. Okay. Stop!
We want to get them to do as much as they can themselves.
Oh, that's perfect. Okay, we're doing donuts. That's not supposed to happen until you're 16. Ha ha!
It's just fun because you've made a difference.
I'm Denise Constanti. I'm a physical therapist with the Jackson Clinics. You definitely need to have your hands on the patient and feel how their muscles are working and seeing if they're flexible. You have to have all 3 things coming together: flexibility, strength, coordination. I've actually come from this from the inside out. I was an amputee at a very young age. I had a prosthetic all my life. You learn to overcome, and I wanted to teach others how to do that for themselves too.
And what we call the ligaments, the things that keep the leg together. I'm a physical therapist assistant. All right, so now we're working your knees. If you want to be a physical therapist, you want to have a passion for the human body, because that's what you do. The human body is your business. Stabilize.
I used to have a problem with walking on the outside of my toes.
So what we wanted to do is teach Nikki to land more with her feet straight, and notice that when her foot is like this, she has got a normal arch. With every physical therapist who works with any athlete, you want to see your person win. And I want to see Nikki win, and I want to see her go out there and win medals.
My name is Virginia Howe. I'm a physical therapist. We're in the MATSI. It stands for the Military Advanced Training Center.
I
I just want to get up and walk or just run, and I can't. I've learned how to do everything again. My legs were taken away from me. I need to learn how to live all over again.
When you are missing your knees, like Brian is, and you get mechanical knees or computerized knees, you have to relearn how to walk in a different way than you did before.
I'm the research physical therapist at Walter Reed, and I do a little bit of clinical work through my day, but as a research physical therapist, I'm also doing research through military grants. Andrew's actually just learning on the power knee.
I can see the potential it has, but right now it's just trying to get used to when it's going to move and how it's going to move. It's just really difficult.
So all of my day is spent doing amputee research and treating amputees. And then some of our research is early rehab, some of it's late rehab, some of it's to do once you go home. We try to hit all aspects of care. That red line that's coming up when he's walking over this gray area, for the joints that you do have left, your hips, and you're on this side, your knee and your hip, you want to kind of minimize those forces, or at least make them as normal as the knee would expect. These guys are great to work with. They're unbelievable. It's orthopedics to the extreme because you're doing sports med, orthopedic rehab, but with a patient population that wants to do that and they don't have legs and they don't have arms, and you have to figure out how they're going to do it, how they're going to run and jump and ski.
I would like to be able to run my 2 miles in 13 and a half minutes.
This will be him in about 9 months to a year.
It's fun, it's creative, and they make it an extreme challenge every day.
You can be me.
You can be me.
You can be me.
And you can be me.
Wow, that is an inspirational video. I enjoyed that. I would be really interested in hearing, to start off a conversation, Michael, and how you came to physical therapy as a career, if you feel it as a calling or fell into it, or and your particular specialty now.
Yeah, so I started out of high school thinking I wanted to do occupational therapy, and unfortunately, I didn't know much about occupational therapy. I had an aunt and an uncle who were both occupational therapists. I knew it sounded okay. I knew they made decent money at it, and unfortunately, I think that's how just how a lot of people go into their college career. They kind of get an idea of what they want to do. That's why a program like this is so good, to learn about different professions so that you are well educated going into college, knowing what you want to do, or knowing maybe you don't want to go to college, you want to go into another route. So when I was in college, my wife Carrie, we met, and she around the same time had surgery on her knee, had an ACL surgery, and because she couldn't drive and I had a car, I used to take her to her physical therapy appointments, and I saw what they did. I thought it was really neat. And so that kind of got me started in it, and went to school, and here I am today. So, the outpatient setting that I'm in looks a little different than, some of those other settings you've seen. And there's a lot of different avenues that you can take. Physical therapy, if you want to be a physical therapist these days, you have to get your undergraduate degree, which is usually 4 years in something. After that, it's 3 years of graduate school, and you come out with a degree that's called a doctorate of physical therapy. So it's a lot of schooling. It really is. There's some other options with that. One is called a physical therapist assistant, which is a 2-year degree. It's an associate degree that a lot of community colleges will offer. The occupation of physical therapy assistant is changing a little bit in our industry. You want to be well educated in that before you thought about going into occupational therapy. Physical therapist assistant. Along with that, we have different people employed at our clinic too. We have what's called a physical therapy technician, which a lot of times ends up being somebody who is maybe in college, in their later stages of college, or maybe they're finished with college and they're thinking about going to physical therapy school, and they're taking a year off to do some work, and it helps solidify that and to get some experience. And then we also have people that work at the front desk that as receptionists. They do a lot more than reception. They take in new patients when they come in, when they call in. They work with insurance companies. They schedule patients. They work with patient payments and referrals and that type of thing. So
cool.
So there's a lot that's involved in it. So
one question I'd like to ask is, what does a day look like? What's your typical day? Some of the tasks and challenges, that kind of stuff.
Yeah, so in my setting, we have, appointments just like you would go to the doctor or go to anything. We've got a schedule of appointments lined up. So I see somebody. So what happens with physical therapy is somebody scheduled an appointment. They come in, and the first day they're here, I'll do an evaluation on them. So what somebody comes in with some sort of problem, whether it's pain or something they're not able to do. And it's my job to do an evaluation on them to figure out what the problems are and to figure out a solution about how to go about fixing that problem. And so it's just, so my day's filled with either evaluating people or just seeing people for follow-up visits where we're working on those specific things that person needs to get better. So just all day long, you come in, you see somebody, you work on this plan that you have outlined for them, and you just work to see them as the people said in the video. Your goal is to have the person there on the first day with some sort of issue, and to be able to see them on the last day go out, and you've helped them out a lot. And so talking about what got me into this field, I didn't really know that much about this field, but I knew that it took some brain power, some problem solving, and I knew that I liked people and liked talking to people and getting to know people. And I think this occupation really puts that all together well.
Mm-hmm. Someone asked, what's hard about working with patients? What are some of the difficult things you might encounter?
Well, I'd say the hardest thing is that you'll as you get older, you'll learn more and more that there's a lot of different personalities and a lot of different types of people out there. So what's hard about physical therapy is just the same thing that's hard about dealing with the public in general. You have some people that are kinder than others. You've got some people that are more motivated than others. And I find that typically most people are just really enjoyable. And every now and then you find some that aren't as much. The hardest parts about my job, though, are every industry is getting this way, but especially healthcare, where the documentation requirements, the things you have to do to keep up with that are somewhat stringent. Dealing with insurance companies, that type of thing. There's all these things that kind of get in the way of doing the fun part of what we do. So those are the things I would say are hard.
I see. Well, as we approach the ending time, I want to make sure questions are answered. So I'll ask you a couple to address. One would be, can a high school student to explore this profession do some shadowing at Drayer? What kind of opportunities are there for entry-level students, one? And the second one, what if you have regrets about your profession, or you would look back and give advice to a high school student?
Yeah, so no regrets at all. Yeah, like I said, it's a long road to be able to get here. You're talking, usually about 7 years of schooling. But I have no regrets at all. I know that I've been called to this profession and feel like it's the right place for me. What was the first part of that? I'm sorry.
So if a student's looking for an entry-level position at Drayer, what pathways are there for them for exploring? Sure. And
yeah, so for high school students, as far as positions go, we don't really have much of that, but we do offer some shadowing opportunities. I think it's good for anybody looking to go to school to get out and at least spend a day or two in any profession that you're looking at doing, just to get some idea of what that's like on a day-to-day. We have a lot of college students that come and do shadowing here, not as many high school. We don't cater as much to high school, but we do allow those opportunities because, like we said, we do think that's important. But yeah, definitely have those chances.
So besides being a physical therapist, are there other, you said there's front desk work, there's probably administrative work, those paths that people could start down before making that big commitment to a 7-year schooling thing. Is that right?
Yeah, so most people that we get, they're going to start out, in one of those commitments. So if you're going to be a physical therapist assistant, sometimes you might spend some time working as a physical therapist technician in an office, and every office does things differently. And like I said, I mean, there's lots, there's my isolated field, but there's also, like I said, there's nursing homes, there's home health, there's the hospital setting. There's a lot of different places where you can get some exposure to physical therapy.
How many patients do you have in a day or on your roster generally?
Yeah, I would say in a day, usually average probably about 10 or 12 people a day. And that just, depends on the day. We'll have heavy days where I'll see, 14 or 16 people and some lighter days too. And, it just sometimes varies on the clinician and just how you operate as well.
What kind of personal traits and characteristics do you think are really important for fulfillment and success in your career? And what might an employer be looking at if they're looking to get a high school student in their physical therapy business?
Yeah, so you have to enjoy people. If you don't enjoy people, this is a tough profession for you because you'll be miserable having to be around people all day, every day. So if that's not something that excites you, then it's probably not the best route for you. You have to be somebody who can be an independent thinker, somebody who is motivated to not be asked to do things all the time, but to look for opportunities to be helpful. I think that's that case. I think any employer in any field is looking for that as far as, people, there's the tendency to kind of hang back and wait to be told, but there's also a lot of value in trying to put yourself out there and be helpful. So that's important as well. I think just in general, curiosity, initiative, and just general friendliness.
Okay. Well, that's very helpful. I think we've come to the end of our time, but it's been fascinating and great to meet you. And thank you so much for giving us insights into your work.
Yeah, no, I think this is great, what you guys are doing with this. So,
thank you guys so much for your time. Thank you for being able for your presenting and ability to kind of showcase physical therapy to the students here. Thank you guys.
Sure thing. My pleasure.